Chat Night Africa. Welcome to Chat Night. Chat Night Africa. Welcome to Chat Night. We bring you good vibe. We shine on the light. Welcome to Chat Night. We bring you good vibe. We shine on the light. We all over the world. Chat Night Africa. We all over the world. Chat Night Africa. Welcome to Chat Night. We bring you good vibe. We shine on the light. Welcome to Chat Night. We bring you good vibe. We shine on the light. We all over the world. Chat Night Africa. We all over the world. Chat Night Africa. Welcome to Chat Night, the only place that we give you good vibes. Chat Night Africa.
Chat Night Africa. Let's gang up, change mindset, and empower Africans. Are you ready? Africa to the world.
And now, live from the headquarters of Chat Night Africa, Divine Shamika.
And welcome to this week's edition of Voices of Africa at Chat Night. In case you did not know this, more people die as a result of lung cancer each year than from breast, colorectal, and prostate cancers combined. You perhaps have heard that some foods could stop or prevent lung cancer. Any truth to it? By the way, why is lung cancer the most common and the deadliest in the world? Ladies and gentlemen, these questions and more on this show. Let me ask you one more question. What makes your lungs vulnerable to cancerous attack? What you do or don't do. Join me now in welcoming a pulmonologist on the platform who will take some important questions from me, but also from you. In the course of the broadcast, I will open the phone lines so that you can yourself dial in and question the doctor. This week, ask Dr. Pascal Kingah. Here we go. Here is our specialist for the evening, Dr. Pascal Kingah. Doctor, welcome to Voices of Africa at Chat Night this week.
Thank you. Thank you so much, Divine. Thank you for having me.
The question I guess somebody's scratching his head or her head asking is, why should I sit here to hear a talk or to hear Dr. Pascal Kingah answer questions on lung cancer? If you were asked that question, what is your answer?
Well, as you cited earlier, Divine, lung cancer is the deadliest form of cancer or cause of cancer death in the world after skin cancer. Lung cancer is the most prevalent cancer, especially if we combine both men and women, for women after breast cancer and for men second to prostate cancer. So it is the deadliest and it is the most frequent, and it affects a very significant part of the population. So it's an important cancer to enlighten our people about.
Dr. Pascal Kingah, another question which I can imagine so many people ask or want to ask you is, do people get exposed to lung cancer because of what they do or don't do?
Absolutely, that's a very important question. What people do, starting with, for example, smoking, which we all know is linked heavily with lung cancer. Cigarette smoking is linked to 90% of lung cancer cases. So if you're smoking, and you definitely increasing the risk of having lung cancer. There are other things that predispose us to lung cancer that I will try to pause here for a second and talk a little bit more about, because sometimes people wonder why their loved ones develop lung cancer despite the fact that they were not smoking. One of those things is radon, the second most common cause of lung cancer. This usually affects a lot more people that have homes that have basements. Radon is a radioactive substance that is emitted from the underground surface, from rocks. And over time, in homes that are old and have basements and have cracks in them, there's a risk of the radon coming up into the home environment and predisposing us to a lot of radiation that can increase the risk of cancer. So it's good to have your homes checked. Now, there are some commercial kits of radon checks that you can order and do it yourself, but usually it's better if you're suspecting, especially if you have a basement home, have the environmental services check it out for you and try to mitigate that. Another important thing that predisposes a lot of our people is asbestos. So people that work in specific sectors such as shipyards, and also people that work in painters and construction workers. And these are also areas that people get a lot exposed to substances that can predispose to developing lung cancer.
You are watching our specialist for the evening, Dr. Pascal Kingah. Dr. Pascal Kingah, you are a pulmonologist. Where do you come in from the diagnosis, treatment, and management of lung cancer? What's your role?
Very good question, Divine. As a pulmonologist, the role of a pulmonologist is to help diagnose and also manage some aspects of management. But mostly the pulmonologist participates a lot more in the diagnosis. And depending on the level of your cancer, and depending on the stage, meaning how advanced your cancer is, the pulmonologist will also have other roles. Management of lung cancer is a multidisciplinary front, including a pulmonologist, a hematologist who is oncologist who treats with cancer drugs, and a radiologist, as well as thoracic surgeons. So we work in close collaboration with all these other specialties to treat lung cancer. So a pulmonologist primarily is to help with the diagnosis, but if you have an advanced stage cancer where you have unfortunate scenarios where you have fluid around the lungs, the pulmonologist can help to drain some of the fluid out. But mostly we participate in the diagnosis, which will include a specific procedures such as a bronchoscopy or endobronchial ultrasound biopsies. So biopsies are procedures where we take small tissues of the lungs and send to the lab for analysis and confirmation of lung cancer.
When cancer gets to your lungs, what does it do to become such a huge problem?
Number one, unfortunately, when we have a scenario where cancer is found in your lungs, the lungs are, first of all, a very vascularized organ, meaning there's so many blood vessels. So by the time it gets to your lungs and it gets into blood vessels, it becomes a problem, or the lymphatic system. So it can also apply pressure on other vital organs that are in your chest. It's because your lungs are located in your chest, and it can spread. So when it spreads, it can spread to the bone, it can spread to local organs like the lymph nodes or other bigger blood vessels. At that point, it becomes a real big problem. So usually we are trying to prevent it from getting that far by other processes such as screening, which I might, if I have more time, I might elaborate more on that, which is a process in which we try to prevent and detect the lung cancers early enough so that we don't find them at advanced stages or stages that become untreatable.
Lots of people in the United States and even in Europe, they have homes that have basements. And you raised a very important question there, that usually it's as a result of radon. Now, is radon, when it's coming into your basement or it's seeping through, Is this something you can smell? Can you detect it? Can you just go to a Walmart and buy something there, install like you install smoke detectors or carbon monoxide detectors in your basement, and can be able to see or know that, hey, I'm being exposed now?
Yes, absolutely. There are commercial kits for radon detection, and as I mentioned earlier, it's usually homes that have cracks on the walls, basement homes that have basements that have cracks on the walls, cracks on the floors. Those are the homes that are really predisposed to a significant radiation exposure from radon. And there are commercial kits that you can buy. You can buy from Amazon, Walmart. You can buy all over the place and use them. Now, I can't tell you which one is the best, but there are definitely commercial kits that can be used to detect radon. It doesn't really smell. I think one of your questions was about whether it smells and you can detect or figure it out from the smell. It's not, and it also varies a lot in the amount over time. On the amount of concentration in people's homes. So it's important to, if you have a basement, it's an older home and you're concerned, to get a commercial kit, start from there, and if it's a high level, then you want to contact environmental services to mitigate radon exposure.
You are watching Voices of Africa at Chat Night Africa. That's the platform. The broadcast is Voices of Africa, and today we're talking about the most common, the deadliest cancer in the world, that is lung cancer. My guest tonight on the show this week is Dr. Pascal Kingah. Dr. Pascal Kingah, there are lots of cancers. I mean, a plethora: cancer of the bone, cancer of the nose, cancer of the throat. I don't know what part of the body would not be attacked by cancer. But the question that leads me to this question is lung cancer, therefore, different from other kinds of cancers, aside from the fact that it attacks the lungs?
Yes, it is different from other types of cancers. There are two main types of cancers, of lung cancers. By two main types, we have what is called the non-small cell lung cancer, which is the more common type of lung cancer. It affects 85% of people with lung cancer, and the other class, which is called the small cell lung cancer, which is mostly the cancer that's mostly linked to cigarette smoking. The fact that the lungs are so exposed to have a direct exposure to the environment, and with a significant surface area, if you were to spread it out, half the size of a tennis court, gives you the risk of the tendency that the lungs are more exposed to noxious substances that can then be deposited there and lead to change in the nature of cells. So those are some of the particularities of lung cancer.
Lung cancer and smoking, and that gets my attention. And that's because one of my family members died of lung cancer when he never smoked. How do you explain that? And people have smoked and never have developed lung cancer. How do you convince them to stop smoking?
Well, that's a very good question, Divine. And as I alluded earlier, there are other things that can predispose us to developing lung cancer apart from smoking. We talked about radon, we talked about nickel, we talked about people working in shipyards, construction, painters. All these jobs are exposed to a particular, for those that did some chemistry back in high school, the substance is particular benzene ring, as they call it, the benzene ring. These substances are very noxious to the lungs, and because when you get exposed by these substances during your work, there's a high chance that you can develop lung cancer. So you would have scenarios where we might have cases where family members will say, "Oh, my loved one never smoked, but they developed lung cancer. Why?" So this is some of the reasons. And another one of the group of or class of lung cancers is the cancer that comes from another primary or another organ to the lungs, which we call metastasis. So those are the three major groups. So you have the one we talked about earlier, the non-small cell lung cancer, the small cell lung cancer, and then you have metastasis. Now, the particular type of lung cancer that affects non-smokers is called an adenocarcinoma, which is under the group of non-small cell lung cancers. And unfortunately, those cancers are usually very aggressive as well. But for sure, cigarette smoking is the leading cause, the leading risk with over 90%, followed by other substances such as radon, exposure to work exposures, construction workers, and painters.
Again, I have so many friends who smoke, some family members. I've never smoked at all growing up in my life. What is it in cigarettes that predisposes somebody to lung cancer? Why not water? Why not salt? What is it in cigarette?
Well, number one, the smoke inhalation and exposure continuously destroys the cells and protective mechanisms of the lungs, number one. Number two, to be honest, people always wonder what is it in cigarettes. We cannot really tell what is it specifically that's in cigarette that causes, but we do know that smoking exposure destroys the protective membranes of the lungs, and also leads to chances of cells changing or changing form and then developing to overdrive and overgrowth, which we term cancer.
How do you explain that there are so many cancers around? As I told you, a plethora, a legion of cancer types, but lung cancer is the deadliest. We understand why it's the most common. You have brain cancer, you have liver cancer, you have pancreatic cancer. Explain to us, I just got that text. Explain to us again, sir, why is lung cancer the deadliest?
Yeah, so as I said earlier, number one, the lungs are exposed to the environment, so we're exposed to so many noxious substances. And the lungs are a very, very big organ. So it's so much exposed to the environment. It's over the size of the lungs. If we were to spread it out, it would be like half the size of a tennis court. So for sure, the lungs are more predisposed to environmental substances that can cause damage and cause change. Because the basic premise here is that you have something that hits the cells. The cells are at a stable state, something hits them. And unfortunately, because we're exposed to so many noxious substances, when you have that first hit, it changes the way the cells will grow, and then leads to uncontrolled growth, leading to cancer. So unfortunately, the lungs have so much exposure to the environment, and also highly vascularized, meaning even by the time you discover it, sometimes it's already spread to other parts of the body.
And that's exactly the problem. By the time you discover it, why is it that somebody comes to your office and the person is a smoker and you're not asking the person to check for lung cancer? Why is that so?
Very good question, Divine. If a person is a smoker, so there was a big trial which was called the National Lung Screening Trial, carried out in the United States in 2011. Where they studied over 50,000 patients, and the study showed that basically from that trial, the recommendations were that if you're smoked over 20 pack years, by 20 pack years we mean you smoke 1 packet of cigarettes per day for 20 years, or you smoke 2 packets of cigarettes a day for 10 years. If you smoke that amount of cigarettes in your lifetime, then, and you're between the age of 50 to 80, then the recommendation is for you to go for screening, meaning you will go to get a CT scan, which is a picture image, detailed picture of the lungs that will show us areas or spots on the lungs that can be detected early and followed up over time to make sure that they don't develop to cancer. So if you fall in the above categories that I mentioned, absolutely, your doctor should be recommending you to get a low-dose CT scan. And even if your doctor doesn't recommend, you should ask, because you definitely need to get a low dose CT scan if you fall in that category. Because once it's detected early, it can be followed up over time, and also because it has an impact on treatment. When you detect early, there are certain stages of cancer that can be completely cured by surgical resection or surgical removal of the tumor. So it is absolutely important that people know that if they have been predisposed, they can be screened and need to be followed up over time by their physicians.
I am having, by the way, thank you, Dr. Brownhill dos Santos, somebody who knows you very well. She's texting a lot of information. She's also a specialist like you. I really want to appreciate Brownhill dos Santos for all the information. I will from time to time be sharing some of the views that she's posting in our studio. By the way, anybody can read all the things she's putting out. Dr. Pascal Kingah, what should somebody look out for as signs of lung cancer? What should make me think, could be it's attacking me?
Yes, very good question, Divine. You definitely should start thinking of seeing a physician if you're having chronic cough. By chronic cough, the textbook will say chronic cough is cough that has lasted average 8 weeks, so 2 months. But if you have a lingering cough that you've taken medication and it's not going away and it's still there, definitely you have to see a physician and get followed up. Now, if you're getting short of breath, if you are having some symptoms such as wheezing, meaning whistling sound when you breathe, or you're having chest pain, this is telltale signs that you definitely need to be evaluated. Or if the worst one is when you're coughing up blood, it's really not a good sign, and you have to get evaluated. Weight loss as well. So if you lose weight abruptly and without a clear known cause, yeah, definitely you have to check that. And also if you're having a recurrent pneumonia, sometimes recurrent pneumonias are a sign of lung cancer, meaning that you have a pneumonia, the doctor treats you with medication, doesn't get better, you're losing weight, you still have a pneumonia again. Those are also significant and telltale signs of lung cancer. So you definitely need to be checked if you're having recurrent pneumonias.
You are watching Voices of Africa on the platform Chat Night Africa. My guest this week is Dr. Pascal Kingah. And Dr. Pascal Kingah will be right back on the platform. Time for us to have this musical transition. The Oko Ninjas of the Northwest region of Cameroon. Voices of Africa, and my name is Divine Chamukong. I'm your anchor in Washington, D.C. metropolitan area. Ladies and gentlemen, join me one more time in welcoming Dr. Pascal Kingah, our guest, our specialist for the week. Dr. Pascal Kingah, our specialist, talking this evening on world's most common, the deadliest cancer, which is lung cancer. You talked about the signs. At what stage do you begin to see those signs? Lung cancer, like other cancers, have stages 1, 2, 3, and 4. At what stage do you begin to see signs of lung cancer, sir?
Very good question, Divine. So lung cancer, you start seeing most of the signs that I cited earlier, meaning, for example, coughing of blood, cough, or shortness of breath. You start seeing those signs, unfortunately, when you can pretty much consider them a little bit advanced stage, meaning stage 2, stage 3. Rarely would you see those signs in stage 1, unless it's pretty close to a blood vessel, pretty close to the airway. So you pretty much start seeing major signs when you're dealing with advanced stage, which is unfortunate. And but as I said earlier, even though you could see some of those signs in stage 2, early stage 2, some early stage 2 and stage 1 can be treated with curative intent. And since you mentioned the stages, I can actually go a little bit further to explain to our viewers what the stages are. So when the first, we talked about screening. So when you screen for lung cancer and you do this low dose CT scan, if you find a lung nodule, so if you find a spot, doctors commonly call it a spot so that patients can understand when they see a spot on the CT scan. When they see that spot on the CT scan, which they call a lung nodule, it depends on the size. So usually if it's a smaller size, if it's less than 1 centimeter, then you need some follow-up. And if it's more than 1 centimeter, then there are some nuances where we either become aggressive or we watch and we'll resect or take it out completely. Now, stage 1 is when your tumor size or the size of the cancer that is found in your lung is less than 3 centimeters. That defines stage 1. So it's considered a smaller size, it's less than 3 centimeters. Now, stage 2 globally is between 3 centimeters to 5 centimeters, and then stage 3, 5 centimeters and above. Now, it also, and stage 4 is when you have a significant spreading with metastasis, the tumor going to other parts of the body. And the classification is a little bit more complex than that because it's what they call a tumor, TNM, tumor nodule, and whether it is spread or metastasis. But based on the sizing, those are the simple way you can look at it. But you will need to sit down with your doctor once it is detected. They will tell you specifically what size and what stages it is. And as I said earlier, usually stage 1. The importance of doing the staging is so you can treat, right? So stage 1 is usually the ones that can be curative with surgery. Now stage 2, some forms of stage 2, early stage 2, some surgical treatments can work, especially if it's not involving the chest wall, if it's not involving other vital organs, and if the lymph nodes are not on the other side of the chest. Yes, those ones can also be resected. So whereas the advanced stage 2 and stage 3, you can treat with radiotherapy, chemotherapy, and some advanced stage 3s, and then stage 4s, you can treat with immunotherapy if chemotherapy doesn't work.
If you have a lung, you can have lung cancer. If I understand you very well, somebody just sent me a text now. By the way, you can dial the number 240-603-7367. You can dial the number 240-603-7367. Now, the question somebody just texted me is, probably missed your answer earlier on. If somebody would smoke and perhaps never have lung cancer, how do you persuade that person to not smoke?
That's a very good question, Divine. So you will not be able to know if you will develop it or not, right? So, but we know that 90% of lung cancers are associated with cigarette smoking. And there is a small percentage, 10%, that's not associated with cigarette smoking. And we talked about the risks and the other things that predispose people to developing lung cancer without having smoked cigarettes. But what we really don't know is why some people don't develop it at all. And but we do know is what I'm explaining to our viewers. Unfortunately, we don't know for sure why some people don't develop it. But there are studies out there trying to figure out that, but we are not there yet.
You kept saying low dose of radiation. Are there times that radiation could become in itself a problem concerning lung cancer for those who don't have it at all? Because here's why I'm asking you this question. A lot of the time you go to hospital for one reason or the other, they ask you to do radiation. Should you be worried about the number of times you are being asked to do radiation? If yes, say how many times per year? What is high radiation and low dose radiation?
Oh, that's a very good question, Divine. So if you're doing, as far as, let me start with the low dose CT scan. So the low dose CT scan is a scan of the lung in which the amount of radiation that's used is really very small, because the intensity is not really needed to be so highly specialized to or highly concentrated. So that's what's called a low dose CT scan. Now, when your question regarding exposure to radiation is a different one. Whether it depends on what test you're talking about. Now, if you're talking about a simple chest X-ray, the amount of radiation emitted from the simple studies like chest X-ray is really less. It's not that deleterious. Now, when you start going to doing multiple CT scans over and over, let's say more than 3, 4, 5 times a year, meaning high full body scans, a significant amount of exposure to radiation, that can be concerning. Now, but the amount of exposure is not a lot to the point that it can trigger you to develop things like cancer. The people that work like physicians or radiology technicians that work in settings where they deal with radiation all the time, they actually carry a dosimeter, which measures the amount of radiation that they get exposed to. And when they get to a certain amount of radiation that it meets a level that can become deleterious and with increased risk of cancers, then they have to step aside. So if you're not getting more than 10 radiations per year, to like 10 CT scans or MRIs, really we're not too concerned about radiation exposure. So a lot of times people get scared when they say you're going to get a CT scan, whether they're going to develop a cancer from that exposure. No, unless you're really getting a lot of exposure.
Now, you're talking about a stage of lung cancer which could be helped by surgery. How frequent is lung cancer discovered or detected when it's still at stage 1 or stage 2? And what leads to you doctors detecting that somebody has lung cancer at stage 1 or stage 2?
That's a very good question, Divine. Unfortunately, we're still detecting only 5 to 10% of stage 1, which is really the cancer that we can actually treat and cure. And that's why, that's really the importance and the important, I hope the message I pass along to my viewers during this talk, because low dose CT really is to be encouraged and really vulgarized so that people know that there's something like that to detect early. Because if you get a low dose CT scan and the lung nodule is detected early, and we follow it over time, and at a certain point, if we see that it's increasing, then we will guide the management. And if in those cases that is a stage 1, we'll say, hey, you're going to need surgery. And I've had cases like that where I've had patients had lung resection and they're doing fine. So definitely that's a very important aspect of lung cancer that unfortunately has not really been well known by a lot of people and our population in particular. I
want to thank Beatrice Moma in Detroit, Michigan, I see some information she's posting out there. Liliane Fomunung, thank you so much. You talk about secondhand smoking and so on. So, there's so much people interacting, so many people interacting, giving so much information out there. So even after the show, you can go on our website. You can go on our, thank you, Dr. Brown Hilda. My God, she's just pouring out so much information. Peter Kum, thank you. Here's a question Peter Kum posed. Would you say COVID-19 has aggravated the global situation of lung cancer? What is the relation between these two?
Oh, that's a good question from Peter. So unfortunately, with the situation of COVID, when we had the first surge, what happened was that most hospitals kind of shifted their concentration and their resources more towards managing patients that were hospitalized with COVID. And what does that lead us to? It leads us to a scenario where people that have screening plans and other program surgeries and things like that did not get care. So we are now seeing, unfortunately, people at advanced stages of their diseases. So unfortunately, COVID was one of what you can call an unfortunate double whammy, where we have scenarios now where we're still dealing with COVID, it's still a pandemic, and we're now dealing with patients that were never able to get appropriate care because of COVID. So for sure, Peter, your question is right on the money. And same scenario here, we'll take this platform to encourage our folks to get vaccinated and hope that one day this pandemic is behind us.
You are watching Voices of Africa on the platform Chat Night Africa. My guest this week is Dr. Pascal Kingah. And I am your host, Divine Chamukong, in the Washington, D.C. metropolitan area. Let's talk about, move a little bit to treatment. But before I get to that, you must have seen, and this is the big one this evening, you must have seen online, there's plenty of information talking about foods that can prevent cancer, foods that can treat cancer. Is there any truth to this? Can people rely on certain acidic citrus fruits, for example, or other fruits, sour salt, they call it sour, I see all kinds of stuff online, to treat or prevent lung cancer?
Very good question, Divine. So what these fruits and vegetables offer is what we call antioxidants. And they are mostly from what we call a group of substances called phytochemicals. And these phytochemicals offer prevention of cells from growing, lung cancer cells from growing globally, as a whole. But as regards treatment, unfortunately, these do not treat cancer. None of these phytochemicals have been proven to treat cancer. So if you have lung cancer or if you have another type of cancer, go to your physician and get checked and follow appropriate treatment. All these fruits and vegetables do not treat cancer. Some of them have been shown to help prevent or slow the growth of cancer. But once you have cancer, you want to see your physician for treatment. I've
also heard situations that people say, oh, you know what? If you have cancer, lung cancer or any other cancer, what you do is starve it of sugar, starve your body of sugar, if I'm not making a mistake. Have you heard that, sir?
Yes, I've heard that. Cancer cells feed a lot on sugar. There are some studies out there with ketogenic diets using ketones and trying to prevent the cancer cells from getting sugar. Those studies have not panned out, unfortunately. They don't treat cancer, so that's all I can tell our viewers this time.
Thank you, Rosie Tato, for joining us on the platform. Rosie Tato, Peter Kum, Dr. Brown Hilda, who's a specialist like you. So many people are watching this broadcast. Dr. King, Pascal. My question moved a little bit towards alternative treatment, something which, is not the classic procedure to handling cancer patients. What is very classic or the normal, what is the normal procedure? Chemotherapy. When one of my family members had cancer, she said, honestly, chemotherapy only quickened his death. Is that a realistic assessment? Is that true? Is that possible?
First of all, Divine, that's a very good question. Now, it really depends on the stage of the cancer. Unfortunately, chemotherapy medications have side effects, and you can have scenarios where we're dealing with an advanced cancer. I don't know if it's whether it's advanced stage 3 or stage 4, where it's already spread to other organs. So there's a risk that if it's already spread to other organs, it's time to be much more realistic at times and let the patients know what we determine as their survivability or the rate of the chances of survival with treatment. But unfortunately, I always say that unfortunately we are not perfect as physicians. But unfortunately, some of our physicians are not that realistic. They don't tell these patients that they have advanced disease and they put them on treatment. Unfortunately, it happens. So I don't know if that was a scenario. And also there's another side of these advanced therapies that the patient's immune system get some sort of subdued and they are predisposed to infections. So there's so many things that come with treatment. But yeah, the patients have to probe their physicians and really ask them, and also do their due diligence and read, because there's a lot of information out there on cancer treatment as well.
As you can imagine, I didn't go to medical school. Lots of people didn't go to medical school like you. We're not privileged to do that. When you talk about, when you handle patients, are you treating them? Are you managing them? What is it you are doing? At what stage of lung cancer?
So we basically we are involved in the management. So as we talked about the first stage and stage 1, we are involved in diagnosing, so figuring out what kind of cancer it is. When we do, for example, a bronchoscopy, or the radiologists do a biopsy, the tissue is sent to the lab and they figure out what kind of cancer, whether it's cancer first of all or not, and what kind of cancer it is. Now, we also do other tests to determine whether the cancer has spread. So when we did a CT scan of the chest, it will also show us whether it's gone to lymph nodes. Now, if it's gone to lymph nodes, that becomes a different stage. It becomes an advanced stage, probably stage 2 or stage 3. And if it's gone to higher advanced stages like a stage 4, those are times where you really have to not be as aggressive, but letting the patient know, unfortunately, that things are not that well. Medicine has limitations. That's one thing we have to all agree on, and try to get things better and do more research and try to get more treatment. But when we have your question regarding the stages, at what stage do we intervene? We intervene in all the various stages in collaboration with the other physicians that I mentioned earlier, the oncologist who's going to treat with chemotherapy, the radiologist who's going to treat with radiation therapy if it's a stage 2 or stage 3, and a thoracic surgeon who is going to resect or take away the tumor if it's a stage 1 or an early stage 2 disease.
You are watching Voices of Africa on the platform Chat Night Africa. My guest this week is Dr. Pascal Kingah. Thank you for coming, Douala Cameroon, for that jingle. The question just sent me. By the way, you can dial the number 240-603-7367. If you're outside of the United States, you can dial by WhatsApp. You can do a WhatsApp call. You do 001 first. 001-240-603-7367. If you are in the United States or Canada, you simply pick up your phone and dial 240-603-7367. Doctor, I've had to know so many people who have died of lung cancer. And when it's getting really, really critical, you're hearing about fluids in the lungs. Is this a common phenomenon? And at what stage do you start having fluids going to the lungs? And at that point, would you advise the person to start maybe bidding goodbye to the family?
That's a very good question, Divine. And unfortunately, when you start having fluids around the lungs, which is called a pleural effusion with lung cancer, that's a stage 4. Now, a stage 4 means that it is really not treatable, meaning you're terminal. People don't like to hear that, but unfortunately, that's what a stage 4 means. There are newer therapies that can help prolong life a little bit, but your chances of survival after up to 5 years with a stage 4 is really very slim. So definitely when you have a stage 4 and you have fluid around the lungs with lung cancer, and if it's tested and it's confirmed that there are cells in the fluid that is consistent with lung cancer, then it's kind of a terminal stage, unfortunately.
Somebody just sent me a text. She doesn't want to identify with the question. That's fine. You can send me texts. You can dial in. If you don't want your identity disclosed, that is fine. Just indicate. The question is, Dr. Kingah, why doesn't lung cancer remain confined within the lungs? Why does it metastasize? I think that's the word, metastasize, right? I'm learning to be a medical student this evening. I'm learning to be a medical student this evening.
I would love to. Divine, that's what we talked about earlier, right? So the lungs, those are the particularities of the lungs that you asked me about. And I did cite specifically that the lungs are one of the most vascularized organs. So the lungs have a lot of blood vessels and a lot of lymphatics. Now, the lymphatics are usually what will carry these small cancer cells to the lymph nodes, and then also will help carry it to other parts of the body. So because the lungs are very vascularized and have a lot of lymphatics, then once you have lung cancer, if you're unfortunate that is close to one of these vessels, then the chances of spread or metastasis is higher.
If you have taken care of a lung cancer patient or a family member has died that you knew, please, if you want to dial in and share your experiences, we'll be glad, because at the end of the day, those who have gone, but the information you share could be of tremendous help to those watching this broadcast. By the way, this show is being streamed live on our YouTube channel called Chat Night Africa. So if somebody's not on Facebook, you simply can have that person watch this show, even when it's over, on our YouTube channel called Chat Night Africa.
Oh, yeah.
And I am Divine Chamakong in Washington, D.C. metropolitan area. My guest this week, taking questions on world's deadliest cancer, lung cancer, is Dr. Pascal Kingah.
Les choses qui arrivent aux autres, comment déjà m'arriver?
Dr. Kingah, a question just texted me. What makes lung cancer terminal? Is it the complications or what? Is it the cancer or its complications that makes it terminal? Incurable.
Very good question. Very good question, Divine. It's unfortunately the complications that make it terminal. As you just alluded earlier, somebody asked a question about fluid around the lungs. So that's one complication, that when you have fluid around the lungs, then the lungs don't expand well. That means you will not be able to breathe well. And we do have ways of helping these patients prolong their lives, meaning we can put a drain tube which the patient can drain at home. And also metastasis, when it spreads to the worst one is when it spreads to the brain. When it spreads to the brain, it becomes a problem. whether you're going to go resect the tumor that's in the brain. Some people, there are some studies about that, but to be honest, when you have lung cancer or advanced cancer start spreading to organs and parts like the brain, your life expectancy really becomes shortened, and it means it's time to start planning. Because unfortunately, a lot of people will think that they still have a chance and they want to keep fighting. It's good to fight, but it's also good to prepare. The complications are usually the big issue here. It can spread it can spread to other parts of the body, as you mentioned earlier. The brain is one of the unfortunate ones, and the around the lungs, causing fluid and making life uncomfortable. So at those, when you have those scenarios, you start thinking about making the patient comfortable.
Dr. Kingah, again, I've had to visit people suffering from lung cancer at the very late stages, stage 4, stage 3, and the pain is excruciating. What is it that makes lung cancer pain so bad? It is I can't even think of any pain that rivals that of lung cancer, especially at that stage. By the way, at what stage do you start having so much pain?
Usually the advanced stages. So unfortunately, it spreads to the bones, it spreads to muscle, it spreads to parts of the body where I kind of have tight space. Then you definitely will start having pain. So the bones are usually the number one part that is related to a lot of pain, back pain when it spreads to the bones and back. And so usually when you have metastasis, which is a stage 4, that's when you start having scenarios like that where you have a lot of pain. The early stages, if it's you will feel chest tightness, and if it's a big tumor which spreads, which is big enough to put pressure on nerves and also put pressure on the bones, you would have pain as well. But usually at advanced stages, that's when you start having pain.
Apart from the pain, virtually just about all cancer patients at stage 4, I hate to say this, but since that's the truth, they look so emaciated. The sight of such patients is scary. Why is that so? What makes the patient to get so drained out, so emaciated? Why is that so?
Unfortunately, patients become what is a term we call in medicine anorexic. So they don't have appetite at all. They don't eat, and the little that is left, is consumed a lot by the cancer cells, and so the patients become very weak. And they lose weight. So unfortunately, and these cancer cells also produce substances that push or elevate the lack of appetite and anorexigen. So unfortunately, these are scenarios where we see with advanced cancers, and at those stages, it's really an unfortunate scenario, and we have to start thinking about making these patients more comfortable at this point.
Chemotherapy, you agree, and everybody agrees that while it's helping the patient, it's destroying other cells. Do you have are there targeted therapies? What are the latest developments in latest research in cancer treatment, especially lung cancer that we're talking about this evening?
Yeah, very good question, Divine, and that is where we're going, right? Because as I said, we have to give chance. Medicine has limitations, but we have to give chance to research, because with proper research, we come out with proper treatment and prolong lives. So there's what we call Pdl-1 inhibitors. These are like, so there are certain receptors on cancer cells, and scientists have been able to detect specific medications that will target those receptors and block those receptors and prevent the cancer cells from multiplying. And by using these, these have been indicated or have been used basically for the advanced stages, the stage 3s, advanced stage 3s and stage 4s. And it has been able to prolong people's lives, give a year or two for most of these patients that have advanced lung cancers. And one of them is common one. I'm not going to be commercial here, but there are so many of them out there in the market, and they are called Pdl-1 inhibitors that attack specific receptors on cancer cells, preventing them from multiplying.
If again you have any questions, you can dial, because we're going to be wrapping up. This was intended to be an hour-long broadcast. If you have any questions, please dial the number 240-603-7367. 240-603-7367. I've asked you so many questions, Dr. Pascal Kingah. Is there something which you would like people to know about lung cancer, predispositions? Oh, I just got a text about gender and race. Are there certain, because people of color, are they predisposed more, or do you have situations like that?
Yeah, interesting enough. That's a good question. Studies have shown that African Americans are more, the male African Americans 15% has a 15% higher risk of developing lung cancer, whereas for whites is the female. So the females, the white female has 10% more higher risk of developing lung cancer than the black female. So there's that racial disparity. But overall, unfortunately, African Americans and blacks have more higher rate of lung cancer than whites.
So perhaps my last question, since people are not dialing, and I'm sure that that's because you are feeding them with a lot of information. Health is wealth. Once in the United States, I was at home for 4 months, not working, not going to work because of surgery. So I know what not going to work, especially in Europe and the United States, mean. Even if you are overseas in Africa, health is wealth. If you're not healthy, you cannot do just about anything. That's why you ought to pay attention to this. When this broadcast is over, you can go back to it. There's so much information that Dr. Brown-Hilda is sharing with you. You can actually share this broadcast. I believe that's going to help a lot of people, whether they are in the United States, overseas. Dr. Kingah, you want to share, is there any other thing I left out? I've asked you a lot of questions. Anything you want to share concerning lung cancer, which I didn't ask you?
Well, one thing as we talked about, I think there's usually a question of what to do and how do we manage these scenarios when we have advanced diseases. As physicians, we're trained to start by thinking about giving a good news when you diagnose lung cancer. If you diagnose it in the early stages, even though it's unfortunate you have cancer, you try to be positive, by telling the patient you are in stage 1 and treatment is curative intent. We plan to cure the disease by doing surgery. And if you have those advanced stages, you have to be kind of empathetic and let the patients know the truth. Sometimes it hurts, but it's better for them to know the truth about the disease. Now, there's one thing I wanted to also mention regarding the risks factors of lung cancer. Some of our sisters and our relatives, our hairdressers, and a lot of our families and friends also use hair products. There is a lot of nickel in some of these hair products, so take a look at them and try to take out the ones that have a lot of nickel in those, and the sprays, the hairsprays. The nickel in those hairsprays can predispose to lung cancer. So that's just one additional information that I did not highlight earlier, which I think is important for our viewers to know about. And if you're diagnosed with lung cancer, seek your help with your physician.
Well, lots of people use hairsprays, and so if you are using hairsprays, if somebody goes to the store to buy a hair product, what should they look at on the content list? Or
you should look for
chemical content list.
Nickel. If you see nickel in it, then it's a problem. If you see nickel, or if you see I talked about the aromatic rings, benzene. If you see anything that has benzene ring in it or benzene written in it, then it's a problem, because those are substances that can be carcinogenic.
I think if there's something somebody should remember this evening, is what you've just said. Dr. Pascal Kingah, before I say goodbye to you, let's have what your last word is.
My last word is I'm very grateful for having me on the platform, Divine. I really wish the best for our people. And please take care of yourselves. If you've smoked for a significant amount of years, if you smoke 20 pack years, meaning if you smoke if you smoke 1 pack of cigarettes a day for 20 years, or if you smoke 2 packs a day for 10 years and above, and you're between the age of 50 to 80, please seek help. Do a low dose CT scan. It is out there. Talk to your doctors and get screened for lung cancer. The earlier it's detected, the earlier it can be treated with curative intent, meaning that we can cure it at an early stage. If it goes to advanced stages, it becomes incurable. Thank you.
Well, thank you so much, Dr. Pascal Kingah, for coming to so generously share what you learned in medical school. We really appreciate you. We appreciate Dr. Brownhilda, Dr. Dieter, all the medical doctors who have come on this platform to share the knowledge from medical school. We don't pay you for doing this. It's an act of community service. We appreciate you so much, sir.
Thank you. Thank you for having me, Divine.
You can also go on our website. You can also go on our website, www.chatnightafrica.net. And when you are on the website, click on Health Corner. There's so much you can learn on the Health Corner of our website. You can actually email privately the doctors who are there. They're going to receive your mail and respond to you, regardless of where you are on the planet. Once again, Dr. Kingah, thank you. This is for you.
Hip, hip, hooray! Hip, hip, hooray! Hip, hip, hooray!
Ladies and gentlemen, we have so much love for you that when we know people who would be of help to you, weaponize you with information, we don't keep that back. Now, coming up soon at Chat Night Africa, on the program Voices of Africa. What does it take to live with the same spouse, man or woman, for more than 50 years? Well, we will invite Pa Kijem, Lucas Kijem, and Mama Lucas and Mama Lucy Kijem, Papa Lucas Kijem and Mama Lucy Kijem. They have been married for 60 plus years. They will be here on Valentine's Day. It's going to be a special broadcast on Valentine's Day. Also on the platform on that special broadcast will be Reverend Dr. Ajimvo. They have been married. Reverend Dr. Ajimvo has been married to Mrs. Dillis Helen Ajimvo for over 54 years. Wow, these two power couples will be here on Valentine's Day to say what it takes to be in the trenches with the same person. How do you handle the monotony? Well, we will hear that on Valentine's Day. While we wait for that broadcast, because it isn't Valentine's Day yet, we have something for those celebrating their birthday today. Now, if you are celebrating your birthday today, or you will this coming week, or you did so the past week, I got a little present for you. Listen to this.
Mannequin.
Happy birthday to you if you are celebrating your birthday today, or you will this coming week, or you did so the past week. And I want to thank all the donors, people who have made this platform to look the way it does. When we started 3 years ago, it was on a little low-tech cell phone. Here we are today with some of the best, state-of-the-art software and hardware in the marketplace to bring you quality programming. Happy birthday to you. Happy birthday to my friends. Oh, happy birthday to you. Moon Paka Bushe Sakai. Sakai. Ladies and gentlemen, that's how we end this week's broadcast. My name is Divine Chamakon. Thank you for watching. If you think this broadcast could save somebody's life, go ahead and hit the share button. By the way, the broadcast is live on our YouTube channel. Simply search on YouTube, Chat Night Africa. Merci à tout le monde. And time I say goodbye. Goodbye. Goodbye.
I'm coming back. I'm coming back. I'm coming. Coming to get down. I'm coming. I'm coming. Coming to dance. To dance. We're gonna dance. We're gonna dance. We're gonna get down. We're gonna get down. We're gonna party. Party hardy. We're gonna boogie. Boogie woogie. And when we jam, it's out of sight. This song right here, it's dynamite. I'm ready. I'm coming back.